In 2011, I was diagnosed with narcolepsy, a rare sleep disorder. I found myself falling asleep throughout the day during class and at work, and became paralyzed anytime I experienced a positive emotion like laughter. Over the course of a year, I went from someone who loved traveling and was full of life to someone who was so sleep deprived they had no idea what they did the day before and could barely leave the house. This left me feeling resentful, confused, and alone. I approached my GP 4 times and was told there was nothing wrong. And when I eventually did get diagnosed, I was told I couldn't pursue the career I wanted and my license was taken off me. Since then, I've been able to advocate for myself and others, and I've learnt that treatments in Australia are almost 20 years behind other countries. The average delay in diagnosis for narcolepsy is 9 to 15 years. And many Australians are unable to access disability support services because narcolepsy isn't recognised as a disability. It led me to ask a really simple question. Why?
In Australia, we don't collect any data about narcolepsy, and there isn't any research done on it. When change needs to be made, we're relying on advocacy and opinion rather than scientific evidence to support it. Before I was diagnosed, I really didn't think much about sleep. But it's one of those situations where you don't know how important it is until it's gone. This is the biggest issue facing the sleep field. Everybody sleeps, but it isn't really valued. That brings me to my research. How can we convince politicians and policymakers and other healthcare professionals that a sleep disorder like narcolepsy is important? And how can we enact meaningful change? My research is broken up into 4 projects. In the first, we look at submissions made to the parliamentary inquiry that were written in by patient and family members who have narcolepsy. In the second, we look at clinical trials and how treatments for narcolepsy are evaluated. In the third project, we interview patients, family members, and physicians to find out what matters to them about narcolepsy. And in the fourth, the development of a patient-reported outcome measure, or a questionnaire, specifically designed for people with narcolepsy.
My first project, I started looking to see if other people's experiences were published anywhere. We found that the Parliamentary Inquiry into Sleep Health received 17 submissions from people with sleep disorders and their family members. Most were related to narcolepsy, and when we analysed these, there were a few common themes around access to healthcare, knowledge about narcolepsy, as well as issues that affected daily functionality. The inquiry recommended policy change on the first 2 categories, but we noticed they didn't address any of the issues that affect day-to-day life, like mental health. What it shows is there's definitely a gap between what people want when it comes to their narcolepsy management and treatment, and the care that they actually receive.
In our second project, we looked at how clinical trials determine what is and isn't a successful treatment option for narcolepsy. We looked at every clinical trial that involved the narcolepsy population, and we found that the Epworth Sleepiness Scale was the most used measure. The problem is that a lot of these measures don't actually have evidence supporting their use in a narcolepsy population. The take-home message is this: there's a gap in our knowledge, and we don't have an easy and accessible way to measure how successful treatments are.
In the third project I'm working on, we're currently digging deeper into the experiences of patients and family members to explore what matters most to them when it comes to narcolepsy. We collaborated with patient support groups and received a massive response of over 200 people wanting to take part. We randomly interviewed 20 patients and 20 family members, and in the middle of analysing the results at the moment. Some of the interesting things that we've found is the need for mental health support for children when first diagnosed, not just for the child, but for the whole family. There's also feelings of dismissal from healthcare professionals felt by parents, and a lack of direction and resources in schools. We also talked to physicians and have so far conducted 8 interviews. The most interesting thing that's come out of this is that there's an underlying sense of apathy towards change. Physicians have approached government and policymakers with recommended changes, but their concerns were ignored. It's problematic, because if there's no research evidence and we aren't listening to expert doctors, then what are we relying on? Finally, the last of my project ties all this research together into the development of a questionnaire specific for narcolepsy. The goal is to capture information that patients and family members consider important. This can be used for clinical trials to measure successful treatments, added to NDIS applications, or used to collect data long term to improve interventions and healthcare delivery. Overall, the impact I see my research having is simple. Nobody should have to go through years of trauma, of being misdiagnosed, of feeling alone and dismissed, when we have the potential to learn from our experiences and improve the way that we manage narcolepsy.